Before we begin, this video is general health education, not personal medical advice. Your skin isn't just a barrier, it's your body's largest sensory organ. Beneath its surface, specialized nerve cells called receptors detect touch, heat, and pain. For example, when you feel a breeze or hot surface, these receptors instantly send signals to your brain. While sensitivity often decreases with age due to nerve changes, other factors like nerve damage can also play a role, altering how we experience the world. Your skin is a complex network of sensors called mechanoreceptors, thermoreceptors, and nociceptors. Mechanoreceptors detect touch, whether light or deep pressure, while thermoreceptors sense temperature changes like heat or cold. Nociceptors respond to pain signals, alerting your brain when you stub your toe or burn yourself. These receptors are layered in the skin, some near the surface for fine details, others deeper for broader sensations. As we age, their sensitivity can change, affecting how we perceive the world. As we age, our skin sensitivity changes. Nerve cells called receptors, which detect touch and temperature, become less active. The outermost layer, epidermis, also thins, slowing how quickly your brain senses these signals. While aging can't reverse this entirely, staying hydrated and using gentle skincare helps maintain skin health. Your skin acts like a sensory network, relaying touch and temperature signals to your brain. Sun exposure can thicken the outer layer, epidermis, disrupting these signals. Pollution may irritate nerve endings, while chronic stress triggers cortisol release, which can alter nerve function, making some areas more sensitive or dulling others over time. These changes aren't permanent, but show how environment and lifestyle shape your skin sensitivity. Sometimes, changes in skin sensitivity aren't just about aging. They could signal something else needing attention. For example, if you suddenly feel numbness, tingling, or pain that doesn't go away, it might be worth talking to a doctor. Conditions like neuropathy, nerve damage, can affect how your skin sends signals to your brain, leading to unusual sensations. While lifestyle changes like staying hydrated and using gentle skincare can support skin health, some symptoms may require medical evaluation. If you notice persistent issues, making a list of your symptoms and discussing them with your doctor can help ensure you get the right care. Not all changes in skin sensation are inevitable. While aging can reduce sensitivity, like making it harder to feel temperature or touch, some myths suggest these are always irreversible. That's not true. Lifestyle choices, like staying hydrated or using gentle skincare, support skin health and may slow changes. However, if you notice sudden numbness, tingling, or pain that doesn't go away, it could signal something else needing attention, like nerve damage, neuropathy. These symptoms aren't normal, so tracking them and discussing them with your doctor can help ensure you get the right care. Your skin isn't just a barrier. It's a sensory organ that reacts to what you put on it and in your body. Staying hydrated keeps your skin supple, helping it sense temperature and touch better. A balanced diet rich in vitamins, like vitamin C and E, supports nerve function, while gentle skincare avoids irritants that could dull sensitivity. Over-the-counter products can soothe itches or pains, but always follow label instructions to stay safe. These choices don't reverse aging, but they support your skin's health, making daily sensations more comfortable. Your skin sensitivity can change with age, but some symptoms need closer attention. If you experience sudden numbness, tingling, or pain that doesn't improve, it could signal nerve-related issues like neuropathy. These aren't normal and may require medical evaluation. To prepare for a doctor's visit, note when symptoms started, what triggers them, and how they affect your daily life. This helps your provider assess whether further testing or treatment is needed. While lifestyle choices support skin health, professional guidance ensures you address concerning changes promptly. As skin ages, it may become drier or more sensitive, leading to itching. Over-the-counter, OTC, products like moisturizers or creams can help relieve these symptoms safely when used correctly. The FDA regulates OTC medicines to ensure they're effective and safe, though they won't reverse aging or treat deeper skin issues. Always follow label instructions and consult a pharmacist or doctor if unsure about a product. These options provide daily comfort but don't address underlying concerns. Stress or anxiety can make your skin feel extra sensitive, like itching or tingling, even without a clear cause. This happens because emotions trigger signals between your brain and nerves in the skin, amplifying sensations. While OTC products like antihistamines for itch or topical creams may help soothe symptoms, they don't address the underlying emotional triggers. If these feelings interfere with daily life, talking to a doctor can help explore whether lifestyle changes like stress management or other factors are contributing. Always follow label instructions for OTC products and consult a healthcare provider if unsure. Your skin isn't just a barrier. It's a sensory organ that reacts to the world around you. But some risks can change how it feels, especially when animals or the environment play a role. For example, ticks carried by deer or mice can transmit Lyme disease, which may cause skin rashes or nerve-related symptoms like tingling or numbness. While not all animal encounters are dangerous, wild animals should be enjoyed from a distance to avoid exposure to germs or parasites. Similarly, environmental factors like temperature changes or pollution can affect skin sensitivity over time. If you notice unusual sensations, washing hands after touching animals or their surroundings is key. Always consult a healthcare provider if symptoms persist or worsen. Your skin is a powerful sensory organ that evolves with you. To keep it functioning well, adopt proactive habits like stress management and gentle skincare. If your skin feels different, whether due to aging or other factors, consult a healthcare provider. They can help you explore whether lifestyle changes or other interventions might support your skin's health. Always follow label instructions for over-the-counter products and avoid self-diagnosis. Your skin deserves care that adapts with you, ensuring it continues to sense the world safely and effectively. Remember, this is general health education, not personal medical advice. For individual guidance,